I'm Katy MacMillan from ODS Consulting, which is the research and consultancy company that was appointed to do some research into public involvement for the Scottish Health Council. Maybe just to let you know, this is the last presentation that you'll have to sit through. I'm going to talk for about 20 minutes about the research findings, but the rest of today is really about gathering your views. There's lots of experience and expertise around the tables here. We want to make sure that today is about listening to you. So about 20 minutes to tell you about the research findings. There'll then be an opportunity for some questions if you want to find out more about the research. I'll also be around all day if you want to catch me over the breaks, and I'm very happy to have a discussion about the research. Okay, so first of all, just to tell you a little bit about what the research aimed to do. We were asked to do research which explored the possibilities for public involvement in health and social care, and this was very much in the context of integration between health and social care services. Now, at the time that we were doing the research, this was about 6 to 9 months ago that we began the research. So the discussions about integrating health and social care were not as advanced as they are just now. There wasn't a bill in place or a draft bill in place. So the discussions that we had and the research we had was taking place about 6 to 9 months ago at that stage. So we were to look at the possibilities for public involvement. That involved exploring the existing arrangements. I think Rosemary mentioned it was seen as very important to build on what was there already and not just to throw out what had already been done. So looking at what was happening just now in terms of public involvement in health and social care. And then to explore the opportunities, the barriers and the options for the future. And maybe just to clarify before I go on, when I use the word public involvement, I'm talking about opportunities to involve people in decisions and discussions about health and social care. People use lots of different words. One of the most commonly used word would also be community engagement, particularly in the local authority side. So we're talking about public involvement, community engagement, community involvement, anything that encompasses involvement of people in decisions around health and social care. I just wanted to tell you a little bit about what we did. As I said, the research went on for some time, over a number of months. One of the first things that we did was we held telephone interviews with 40 practitioners from health and social care. So that was 22 people from the NHS and 18 local authorities. When we were speaking to people over the phone, we were conscious that there might not just be one key contact for public involvement in health and social care. Lots of different people within NHS boards and within local authorities would have responsibility for community engagement and public involvement. So what we did was we asked whether any of their colleagues might be interested in participating in an online survey. Almost everybody we spoke to said yes, and they sent that survey on to others. So we had 41 further people who filled in a survey and told us their views in that way. One of the most important things that we did was we held 6 focus groups with members of the public. We wanted to make sure that we got out and spoke to people who had some experience of involvement in health and social care decisions and discussions. We wanted to speak to people about their experiences so far and how they might like to be involved in the future. Those groups involved a total of 47 people, and we chose them so that they reflected the range of different ways that people may have been involved in discussions so far. So in some instances, we went to the Public Partnership Forum. In other instances, we went to the Community Care Forum, the Community Care Group, or a carers association, lots of different ways of involving people. We chose those in different ways. In some cases, we asked the practitioners that we spoke to who we should go to. Most oftenly, they said the Public Partnership Forum was the key route that we should go to, but we wanted to make sure we didn't just go and speak to 6 public partnership forums, so we made sure we selected a range of different organisations and different groups to be involved. We also did 4 in-depth case studies. Those were in Dundee, West Lothian, Highland and East Renfrewshire. And they were chosen deliberately so that there were some areas where there had been a lot of discussion around integration of health and social care services and some areas where there hadn't been quite so much. There we spoke to people from the NHS, from the local authority and 2 members of the public. what we were doing was exploring their experiences, particularly as we were moving towards discussions about integration and how they felt about being involved and involving members of the public. We also did some interviews with national organisations. So we did 5 interviews with equalities organisations and 6 interviews with other national organisations. So organisations like COSLA, like the Joint Improvement Team, the Scottish Government, the Health Council itself, and CARE, Scottish Care and the Care Inspectorate. And then finally, we wanted to make sure that we weren't just building on the lessons learned from Scotland, but they were also looking at the experiences from across the UK. So we held interviews in England, Wales and Northern Ireland with policy officials to explore what was happening around public involvement in the context of discussions around integration of health and social care in different parts of the country. So that was what we did, and I'm very happy to tell you a little bit more about that if you want to hear. I'm now just going to run through the key findings, what we found from the research, and I'm going to look at 3 main areas. I'm going to look at what makes public involvement meaningful, what did people tell us about what we should be aiming for in terms of public involvement, what are the current successes and challenges, what's working just now, and what do we need to build on and learn from, and what are the opportunities and challenges from future integration of health and social care services. So thinking first of all about meaningful public involvement, what we did was we asked everybody that we spoke to, we said, in your view, what is it that makes public involvement meaningful? What should we be aiming for in Scotland in terms of involvement in health and social care? And it was very clear that there was really strong consistency across the different people that we spoke to about what it is we should be aiming for. And just quickly to summarise the key characteristics that people were telling us. I think first of all, people said, well, public involvement should be clear and honest. It should be clear what the scope of public involvement is. It should be clear what we're asking people and why. And we should be very clear if we've already made a decision about something that can't be influenced and why that can't be influenced. So being clear about the scope and whether you are actually able to influence or change something through involvement. People were also saying it shouldn't be one-off, it should be routine, and it should be happening at all stages of decision making. People were saying too often we get quite far down the line with decisions and we think, oh, we'd better involve people. We should be involving people right from the beginning so that people have the opportunity to be involved right the way through decision making. And linked to that, people should have the opportunity to be involved at different levels. So people should have opportunities to be involved in strategic decision making or influencing local service delivery or the issues that are most important to them. And it should involve different methods, so there should be different ways that people can get involved. People said it should be respected and respectful. We should recognise the really important role of public involvement, and we should deal with one another in a respectful manner. It should be accessible and informed, so people should have the information that they need to be able to participate in a meaningful way and shouldn't face barriers to involvement. A really interesting one, people said it should involve the right people, but people had different ideas about who the right people were. I think the main tension was sometimes people were saying, well, we should make sure that we involve everybody in a demographically representative manner. So we should make sure that we involve all ages, people from lots of different geographies and so on. Whereas others were saying, well, we need to think about what the decision is that we are taking and how people should be involved and what people should be involved. So if it's a big decision about a certain type of service, for example, a maternity service, should we be looking to engage the people who are most affected by that change? So lots of different debates around there and lots of different ideas from the people we spoke to. But one area where there was really strong commonality was that public involvement should result in action. It should result in organisations listening to what is being said and thinking about making changes, ideally being able to then take action, but if you can't take action, explaining why that is and giving feedback to people. Now, I suspect that not much of this is new to any of you, and a lot of it is already outlined in existing standards, but it was quite clear to us that as we asked people about this, there was a really strong consistency from participants. Just a couple of examples of some of the quotes that people gave us. For example, around public involvement needing to result in action. It should act as a catalyst for change, where we really listen to people's concerns and learn from them. And throughout the report, you'll see there are plenty quotes and examples of what people said to us and expressed these really eloquently in terms of what we should be aiming for in terms of public involvement. We also asked people about current successes. What has worked particularly well in terms of public involvement in health and social care? And what people said to us is that practice is currently very varied. There are pockets of good practice and good examples of what has worked, but this is often very dependent on the culture of the organisation or the team. It's very dependent on the individual within the team. If people are particularly interested in public involvement and committed to it, then often it's one individual driving that within the organisation. And it's dependent on the profile and the interest that public involvement has. However, there was a very strong feeling that there was a good base to build on. There were examples of where things have worked very well so far. But really interestingly, when we spoke to people about current successes, it came out really strongly that there were differences between the two sectors, differences between health and social care at the moment. There was quite a strong perception that for social care within local authorities, there was a strong history, track record and commitment to a community development approach. So working with people on a routine, ongoing basis and jointly building relationships. For the NHS, there was a feeling that there was a more formalised and structured approach to public involvement, much more recorded and clear processes for involvement, whereas within local authorities, there's much more diversity. Now, there were different views about whether these were positive factors, negative factors, but overall, I think there was a feeling that the two sectors, health and social care, could really learn from one another, and if these experiences are brought together, then that could help to strengthen public involvement and build on the skills that are already there. We asked people about the challenges that they face at the moment in terms of public involvement. The first and probably the biggest challenge that came out was representativeness. It draws on the question that I was asking earlier about who are the right people. Lots of people were grappling about whether we should be aiming for representativeness in public involvement and also whether that could be achieved. And some interesting questions that people were asking about if we're engaging with, for example, the chair of a community group or the chair of a public partnership forum, does their voice have more weight than a member of another group or an individual who's not connected with networks, because theoretically they should be gathering views from a wider range of people? And some quite interesting debates that people were having in the discussions that they had with us. Another big challenge that people mentioned was the complexity of health and social care itself. People were saying the discussions that we have as professionals, sometimes it's very difficult to keep up to date with all the changes. You saw the raft of changes that Rosemary mentioned earlier. However, others were saying, and particularly members of the public were saying, have faith in people. If you make sure that we use simple language and we explain things properly, that should help everybody, and members of the public should be able to be involved in an informed way. But linked to that, there were some concerns about how does a member of the public remain a layperson? How do they continue to represent the views of a member of the public when they have to know so much to effectively become involved in decision making? So the more you know about how health and social care services operate, are you still reflecting that patient view, or are you becoming part of the system? So some interesting questions there. A few other challenges around political nervousness. Sometimes people nervous about consulting or involving people on big decisions because they were scared about any backlash they might get. Some questions about fear and power relationships when there are big organisations like the NHS and local authorities working with members of the public. How do you make sure that everybody feels equal around the table? How do you balance views? Members of the public often have very different views. How do you make sure that you come to a consensus and think about how to take that forward and make a decision? And then finally, some challenges around staff attitudes. Is public involvement important? Is it part of my job? Is it something that I should be spending time on? And resources. Good public involvement takes time and it takes effort, so it does need resources to make sure that it is effective. We then went on and asked people about the opportunities the integration of health and social care could offer in terms of public involvement. And it's probably worth just reminding you again about the stage that this research took place. At the time when we were asking people these questions, which was just before and just after the turn of the year, a lot of people were quite unsure about what would happen with integration. As I said, a bill hadn't been developed at that stage, and many were unsure about what integration would actually mean, never mind what public involvement and how that would fit in. So perhaps because of that, some people thought that there would be little change in public involvement as a result of integration. A lot of people were saying, well, we've been trying to join up health and social care services for many, many years. We haven't seen a huge change in terms of public involvement. Will this actually make a difference? However, lots of other people were saying there are opportunities. We can see that there are opportunities we could build on, even if we're not sure how those would actually play out. So some people saying that integration had an opportunity for making public involvement higher profile, and some seeing that that had happened already. So as there were discussions about bringing together services, there were also discussions about, well, how do we make sure we involve people in a coordinated way? Some opportunities for creating a single strategy and single conversations, joining up the discussions that health and social care are having with members of the public, and drawing on larger pools of information. There's lots of different information already that organisations have gathered, and sharing that. And then there were some suggestions about potentially rationalising some of the involvement methods. So are we doing the same thing, just in slightly different ways? Can we join that up a little bit more? Can we share our resources and become more effective around that? But overall, what people were saying was, yes, there are opportunities, but we want to make sure we build on what's already there. We shouldn't be going out and creating something new just for the sake of it. We should make sure that we learn from what has happened so far. People also mentioned a number of specific challenges in relation to integration and public involvement. Probably the biggest challenge was around organisational cultures. This is two very different organisations coming together with different ways of working, and some people wondering whether in the integration and restructuring, will there be an internal focus? Will public involvement get lost because so much of it is about how organisations actually work together? As I said before, there were some questions about the extent of integration, the ability to share information between organisations. There were some concerns about the scale of operations, so with some NHS boards operating on a larger scale than local authorities, how will joint working actually work in that regard, and how will public involvement work? I suppose drawing on some of the issues that Peter was also mentioning earlier in terms of very local involvement and how you make sure that happens at that scale. There were a small number of concerns about the strength of existing mechanisms, so while lots of people were saying, yes, we need to build on what works, there were others who were saying, in our area, this doesn't work, and there were particular concerns about some public partnership forums not being effective and not being representative, and people were saying, we do need to build on what's there, but we also need to be honest about what isn't working and moving on. There were some concerns about different standards. Local authorities generally would work towards the national standards for community engagement. NHS organisations would generally work towards the participation standard. There are connections between those, but they're different, and there was concern about how that would actually work in practice. And then finally, there were more concerns about resources. There were some issues around the perception that integration was about saving resources, and if it is about saving resources, will public involvement get squeezed, and will there be resources there to do effective, meaningful involvement activity? Just finally, to give you a little bit of an update on some of the specific areas that we probed within the research. We asked people whether there was room for both permanent structures like a public partnership forum or a community care forum, and ad hoc structures, kind of issue-based opportunities for involvement. What people were saying to us is that permanent structures really give the opportunity for building trust, for building relationships, for building clarity about why and how members of the public can get involved. But there is always going to be the opportunity for ad hoc structures. And what came out from this question was very much that there's a need for ongoing community development, routine activity working with communities. So it can't just be a one-off, it needs to be about building relationships, whether that is through a formal structure or links with lots of different local community groups. We asked people specifically about the potential to use technology to involve people. People were very open to the idea of using technology, gave some really good examples of what had been done so far, but said it's really important that technology doesn't become a barrier to involvement. It's one of a suite of options you should use, but it shouldn't be the only way that people can get involved. And then we asked people, how do we make sure that we involve people who are seldom heard, who aren't often involved in these kind of discussions? When we spoke to people about this, they were saying, well, first of all, the term seldom heard, it's very wide-ranging. We need to break that down and think, well, who do we mean? Do we know who is not always involved in these kind of discussions? Do we know who is likely to be most impacted on by the decision? Can we think about targeted work to engage with specific groups? But people were also saying this is where relationships with community groups, relationships with the third sector and so on become very important. If there's already established trust and people involved in some local groups, can we build on that and make sure that we link into those connections? So really, in terms of what we found, there was a very clear message that for the future, we need to make sure we build on what's there already. But people said there are real opportunities there. There are some opportunities around thinking about the structures, how we actually involve people. There are opportunities around the standards, how do we make sure that we work to the same standards or common standards around public involvement. And there are opportunities around how we assess outcomes, so how we look at what difference public involvement makes in the future and how we track that. We went on from the research to develop a think piece which took some of these findings and discussed those ideas and prompted a number of questions. In the discussion groups, we're going to go through some of these questions and gather your ideas and your expertise around those. But just the kind of questions we were asking are, do we need a national outcome around public involvement? Do we need something which expresses what we're aiming for in terms of public involvement in health and social care? Should we be thinking about shared standards or more commonality in our standards? Should there be some sort of consistency in involvement structures across the country? And importantly, how can we link to community planning, which Rosemary was mentioning earlier? So that's a very quick run through what we found and what we did. I'm very happy to answer any questions and then move on